Welcome, everyone. We're so glad that you are here with us this afternoon or morning, depending on where you're coming from. We will start the webinar in just a minute or two. We're going to let everybody join us. So if you want to put where you're coming to us from in the chat, that would be great. It helps us know, get a sort of context of who we'll be talking to today. And we will have share a little bit more about who's on in the audience with us today. So just take a few minutes, introduce yourself, let us know where you're coming from, and we're going to let folks join in as they're trickling in. Jonathan, I presume they're still coming in. Georgia, Nebraska, New Jersey, Colorado, California, Michigan. Oh, we're from all over. Nevada, Ohio. Yay. We have a very nice geographical representation today. We're going to give just one more minute to make sure everybody can get in and get settled, and then we will go ahead and start our webinar. We'll just give a plug for the exchange. If you are not a member of the exchange, please go ahead and use the QR code or the web address at the bottom of the screen, and that will help you get into a mix of other leaders and champions in the prenatal to 3 space and connect you with folks who are doing the same kind of work that you are. All right, it's 2:02, so that's my signal to officially start the webinar. Thanks, Jonathan. Welcome. My name is Michelle Adkins. I'm the director of the Prenatal to 3 Capacity Building Hub. We are a project of Build, and we're funded by the Pritzker Children's Initiative. I will be moderating the webinar today with my friend and colleague Ngozi. Ngozi, you want to say hi?
Hi, everyone. I'm Ngozi Lawal, and I'm a consultant with the Build Initiative, and I'm happy to be co-facilitating with Michelle. Passing it back to you.
Great. Thank you. So today we're going to be talking about housing access and housing instability and the impact that has on families with young children. And so we're so glad that you're here. This is the second part of a webinar series that we have been doing on housing. So if you happen to have missed the first one, it is available on the Build website, so you can go and take a look. That one focused specifically on homelessness. So if you'll go to the next slide, please. Before we go any further, we want to make sure to give some time for our Spanish interpreter to introduce themselves and to give everybody a chance to choose the language that they would like to hear the webinar in.
Thank you, Michelle. Muchas gracias, Michelle. My name is Lindsay, and I will be providing Spanish and English interpretation for the meeting today under the idea of language justice, where everyone can speak, hear, write, read, and sign in the language of their heart. Entonces, mi nombre es Lindsay. Voy a estar proporcionando la interpretación bajo el marco de justicia lingüística, que es cuando todos pueden hablar, escuchar, escribir, leer y hacer señas en el idioma de su corazón. In one moment, we'll be turning on the Zoom interpretation feature, and as you can see on the slide, a small globe will come up at the bottom right of your screen. If you're on a phone, you might have to swipe to the left in order to see 3 dots to be able to get to that little globe. Once you see that globe, then you will choose your language channel. If you're on a phone, then you're going to need to choose done once you've chosen your language. Entonces, como pueden ver en la pantalla, en un momento van a aparecer un globito terráqueo en la parte inferior de la pantalla. Entonces, si están en un teléfono, a lo mejor van a tener que deslizar hacia la izquierda, buscar los 3 puntitos para poder ver la opción de interpretación. De ahí van a escoger el canal de idiomas, en este caso sería español. Y ya si están en una computadora, ya estuvo. Y después, si están en un teléfono, entonces tendrían que dar clic en finalizar o done. Just remember to everyone, please choose your language channel in case there is any back and forth. Everyone will need to be in a language channel. Por favor, les pedimos que todos estén en un canal de idiomas para que si haya algo de intercambio de un lado al otro, entonces todos van a poder escuchar. With that, Michelle, go ahead and turn on the language interpretation. Ingrid. Entonces ya con eso se puede encender la interpretación.
Okay, thank you, Lindsay. Hopefully everyone has taken the moment to select the language of your choice, and we can move on. So we talked a little bit about who we have represented here from all over the United States and a vast geographic area. So a little bit more about that. There were over 700 registrants for the webinar today, which we're so happy that so many people are interested in this really important topic. And you were from 47 states and the District of Columbia. You are from all sorts of organizations, from state agencies, child and family serving organizations and nonprofits, foundations and philanthropy, child care resource and referral agencies, center-based and home-based childcare, colleges and universities, tribal language and cultural education programs, and the list goes on. So thank you so much for being here with us. We love having such a diverse group of folks joining us. Now let's take a look at what you do. We have Healthy Families, America's Home Visitors. We have staff service managers, directors, vice presidents, project coordinators, youth ambassadors, parent and youth ambassadors, excuse me, policy associates, community school specialists, family services managers. So again, we have a wide range of organizations and roles and efforts that people are making in this field. And so we're really glad that you're here with us. And we hope that you get as much from the webinar as we think you're going to. Next slide. And I think it's Ngozi.
Okay, well, today we have some objectives that we are going to be focusing on specifically, but I want to give you a broad overview of our webinar series. For those of you who are joining us for the first time, this is the Whole Child, Whole Family, Whole Systems webinar series, and we are exploring a variety of topics that impact the prenatal to 3 space. So families who have pregnant people, who have children birth to 3. And so in this webinar series, we have been working to define what is a whole system approach. How can we de-silo the different organizations that serve children and families? Michelle just walked through all of your different agencies and your different roles that you play. So how can we get all of these different sectors to work together to serve the child, the family in a whole way? We've been talking a lot about what are those key challenges that get in the way, and strategies so that the systems can be more integrated. We have been centering family voices and thinking about how to make services more equitable for children and families. And what is really near and dear to our heart is how parents are experiencing prenatal to 3 services. And so we've been beginning our conversations with a parent perspective, just to really center ourselves around what does it mean to serve children and families well. We've been thinking about ways to make sure that leadership is in the conversation, not just the folks who are delivering services at the front line. We've been thinking a lot about how does the data that we have access to inform the ways that we can improve services. We've been learning from real world examples and trying to go beyond books and policy briefs, and been thinking about how to make what we've learned actionable and how can we make these actions sustainable over time. Next slide, please. So Today, we are going to be going, as Michelle pointed out, into the part 2 of our discussion around homelessness. So we spent last webinar in June thinking about what does homelessness mean? How do we define it? The different ways that it's defined, thinking about the different types of homelessness that exists. And thinking about ways in which we can work together to ensure that families are served and are not homeless. Today, we're going to be digging deeper and thinking about what are those barriers that stand in the way of housing access. And so we have a story that we like to unpack with you with a parent voice here. And we want to think about what is the critical role that housing plays in the well-being of pregnant people and infants and toddlers. We want to think about how can we all partner together. Some folks are from the education sector, the early education sector. Some are from housing. We're really excited to have our housing colleagues on. We don't talk enough, so we're really glad that you're here. And we want to think about what are some of the unique challenges that may not come to mind in terms of families accessing housing. And most of all, thinking about what are the opportunities and how can we plan together better. Next slide, please. So here are our esteemed presenters. We are going to begin with Rashina Bungie. Rashina likes to go by Sheena. She's a mother of 2, a Delaware native, and currently working as a homicide mitigation specialist with the state's public defender's office. She brings both personal and professional insight into the realities of homelessness and want to encourage the systems that serve families to do better. Next, we'll hear from Abra Lyons Warren. She's the Director of Housing Is at the Council of Large Public Housing Authorities, also known as CLEFA. Abra brings a systems level perspective on how housing integrates or intersects with health, education, and equity, and how policies can either support or hinder family success. And from Ohio, we welcome Jill Spillman and Hannah Horrigan of the Akron Metropolitan Housing Authority's Building for Tomorrow. Jill leads early learning and health initiatives that position housing as a platform for whole child success. Hannah focuses on education, infant health, and racial equity, ensuring that families can access and navigate essential services. And then finally, we have Beth Bordeaux of Partners for Impact, who brings decades of experience leading systems change across North Carolina. She's currently advancing outreach to connect families with young children to shelter, services, and early care and education. So helping communities respond with data, compassion, and action. So each of today's speakers will help reveal what is unseen, how housing shapes early childhood, and how we can respond with coordinated family-centered solutions. So let's go ahead and get started. So we're going to get started with Sheena. Okay, so Sheena, it's really wonderful to have you here with our audience sharing your story. And from my intro, the audience already knows that you're a mother of 2 children and that part of your story is that you experienced homelessness. So as I was getting to know you, one of the things that you shared, and I quote, is that homelessness is not a respecter of person. It can happen to anyone. And that statement really resonated with me because you talked about trying to do everything right. You went to college, you graduated, you had a good job. Can you walk us through your journey? Tell us a little bit about your story in terms of what led you to have to navigate homelessness with your children.
Yes, so thank you, Ngozi. Good afternoon, everyone. My name is Rashina Bungie, as she mentioned. So my bout with homelessness actually came because of illness. So as Ngozi mentioned or will mention, the different challenges that people experience, and people are judged, by the way they become homeless. They're judged, they assume that they're being lazy or that they, have a drug addiction or whatever the case is. But we know that there are other ways homelessness can happen to you. So that, you know, my case, like I said, was illness. It can happen through divorce, sudden disability. I'm sure you can think of other ways. So I have two children who were diagnosed at birth with sickle cell disease, in the hospital often. So miss a lot of school, you know, a lot of time from work. A lot of employers, I did, and like I said, I did what, you know, what they said you're supposed to do, you know, go to college, get married, you know, do what you have to do to secure that lifestyle. But, you know, sickness doesn't care about any of that. So employees don't, you know, look kindly to that a lot of times, you being away from work and having to be with your children. So that's how we fell into homelessness.
Thank you, Sheena. So you've helped create this progression that you had two children who were born with sickle cell, and it's a pretty serious disease. And like you said, they were in and out of the hospital a lot, which now requires a lot of your attention, which means that you can't be at work. And so employers, your employer in your case, did not think that you were a good fit for the job anymore. And so you lost your job, and that is how you encountered homelessness. Once you did risk losing your housing, what supports did you reach out to, and what happened? And did you face any barriers? What did that look like for you?
Sure, sure. So definitely there definitely were barriers. First was not being able to depend on family. You know, we feel like that should be our first resource, but it's not the case all the time. So it wasn't the case for me this time. So I had to reach out to outside resources, state service centers, social workers, things like that, for help. I was actually lucky to be connected to a shelter, the shelter that I worked for, and was actually able to become housed. My two children and I, at the time, they were 3 and 7. So we were able to become housed. I mean, it doesn't always happen that way, you know. So some of the barriers are, you know, families are on wait lists. You know, they don't get responses back from agencies. Overcrowded. They just don't have the space. So I actually lucked up, and I'm very thankful for that. But I do realize the barriers. Being a case manager, I eventually became a case manager with the shelter that I lived in. So, you know, I realized some of the barriers that we had to maneuver through. So.
Thank you, Sheena. And thank you for just walking us through that, because your story is very special in the sense that at one point you were homeless, experiencing homelessness, and then at some point, once you did secure housing, your caseworker came back to you and suggested, hey, we're looking for somebody who can help, and you became a caseworker. So before we go there about you becoming a caseworker, because I think that is so powerful, about what did that look like, given that you were once in the situation of need. So we'll talk about that in a second. But when you were in the shelter receiving services, can you talk about which supports were most helpful to you? Outside of receiving housing, what kinds of supports did you receive from perhaps partnering organizations or other places?
Sure. So the shelter, the way they were set up, um, they worked with churches in the community. Community congregations is what they're called. And so volunteers would provide their time to work with the families. So we slept in the churches. They helped provide lunches for the children, transportation to schools, book bags, any types of resources like that they could help with. As far as other resources, the shelter provided case managers, you know, they provided job training opportunities. Um, if you needed, you know, maybe you were ready to move, you needed furniture, you needed dishes, things like that. They would help provide with that. So the shelter that we were in was actually set up pretty nice. It was actually a lot better than a lot of shelters I've seen Not to, sound cruel or anything, but I mean, I was just lucky to find that place. And it was actually the ED, she reached out to me, so.
Thank you, Sheena. And so one of the things that you said earlier was that at the time that you experienced homelessness, your children were 3 and 7. So your 7-year-old is, of course, school age, and I'm assuming had the opportunity to go to school during the day while you could get sorted, look for a job, look for training opportunities, all of those things. I'm curious if you could share with us a little bit about how did you manage your 3-year-old? And were there any services, any early care and education opportunities that were available to you?
Fortunately, Delaware does have early childhood education. And so she was able to attend that. She was only able to actually to attend part-time. They have full-time and part-time, but because I wasn't working, she could only attend part-time. So which meant she was with me the rest of the day. So I only had a few hours, a little window to look for work, look for apartments, things like that, while my 7-year-old was in school, of course.
Okay. And can you talk now about, so your caseworker helped you find all of these different supports that you talked about, early care and education for your daughter. And tell us about how you were invited to apply for the caseworker position.
Sure. So on my way out of the shelter, and my time was up, I actually located housing. Thankful for that. I don't know, just one day, the ED, me and her, even as a family, she and I, we built a rapport. We had a really good relationship. And so she pulled me aside one day and she said, I'm in need of a case manager. And I shrugged it off, not as a joke. No, I told her good luck and everything. So she's like, pulling me back, like I need a case manager. So that was her way of asking me, would I be interested in the position of case manager? Because I guess, getting to know me, she got to know the type of person I am, my personality, and that I only want to just, help others. Because I did, however I can help the other families. I babysat the other children, when I could, however I could help if I had it and other families needed it. So she's seen those things in me, and she thought I would be a good fit for a case manager position.
That's really incredible. And so, in your role as a caseworker, it sounds like you had a lot of empathy for those families because you had once been in that role as well. You had experienced homelessness, and so you were able to stand in the gap for them. That's really, really amazing. So I want to thank you so much for sharing all these detail about your story. I mean, you're in front of hundreds of strangers and who don't know you, but we are all really impacted and encouraged by what you've shared today. And, I just continue to think about some of the stereotypical ideas that the public tends to have about the root causes of people experiencing homelessness, like substance use and addiction. Some of the things you mentioned earlier, mental illness, poor decision making, lack of motivation, whatever. But what's intrigued me about this conversation is that when thinking about root causes, most people don't think of the issues that you cannot see. And in your case, chronic health issues and how that can impact your income and your ability and have a place to live. So it goes back to your point that homelessness is not a respecter of persons. It truly can happen to anyone. So I just want to close on the response that you gave me. When we talked about this earlier, and you said, it doesn't matter what presenting issue the family is coming with, you just need to serve them. So can you just expand on that a little bit?
Absolutely. And it goes back to the stigmatization that, however they fell upon homelessness, whether they were being lazy, whether it was their mental health, whether they were on drugs, it doesn't matter. It doesn't matter. There's a need, that needs to be fulfilled. So, and what that looks like could include, some therapy, some treatment, whatever the need is. Yeah, and that's how I worked as a case manager. It doesn't matter.
Thank you, Sheena, and thank you for grounding us in the lived realities behind all the data and statistics that we're about to hear, and for reminding us what's truly at stake. So let's build on that foundation by hearing about how systems can be reshaped to support families more effectively and have more of a national view. So we're going to turn to Abra Lyons-Warren.
Well, thanks so much. And thank you, Sheena, really for sharing your story, your perspective. I think I'll talk about this in a little bit when I get to kind of the current state of the policy budget, but really highlights how health insurance is tied to employment here in the United States. And that is, really can be a very significant problem for a lot of families. So thank you again for being here. As Ngozi said, I'm Abra Lyons-Warren. I am the Director of Housing Is. Next slide, please. So we are a separate nonprofit underneath our parent organization. That's the Council of Large Public Housing Authorities, or CLAFA. So CLAFA is a national member-based organization. Its members are, as the name suggests, large public housing authorities, places you would think of: Chicago, LA, DC, New York, but representation all across the country. And Housing Is, we just celebrated our 11th birthday, and we are focused on the idea that housing is that critical foundation. It's the stability that individuals and families need to be successful, but it's not totally sufficient if we really want to improve life outcomes. So we work to better intersect housing with other areas like health and education. Next slide, please. So here you can just see some of the ways that Housing Is works. Things you would probably think of: we do regular webinars ourselves, we have an annual conference, but we're really looking to lift up best and promising practices. You'll hear after me from the Akron Metropolitan Housing Authority, which is a community that we work closely with. And we love to find out all the great work happening around the country in different communities and help highlight that in the hopes that it can be scaled or replicated. And then we also work with a whole host of other national organizations like Build, but others that have really specific expertise in different topics, so that we can really practice what we preach in terms of promoting partnerships, which is what I will be spending the majority of my time on today. Next slide, please. So I'm not going to spend too much time on this. I think all of you probably know, but I do want to say a little bit more. Housing Is, that name comes from the idea that housing is education, housing is health. And so today we are talking about housing is early childhood success. So I don't think it's a surprise to anyone that when you have that safe and affordable stability, that column on the right, those are the things that we can really see the positive outcomes. And when you don't have that, that's when we see less than desirable or negative outcomes across education, health, and I think importantly, the long-term implications and impacts. I'm sure you all are familiar with the term ACEs, adverse childhood experiences, but there is significant research about both the immediate and short-term, but also long-term impacts on children who experience homelessness. And so I always say, for folks who maybe don't care about this from a moral perspective, right, I think, and I'm sure all of you would agree, that it is simply the right thing to be working to help these families. But for those who may not be as swayed by that argument, there is also a strong cost benefit. It is simply less expensive in the long run to help families now. Next slide, please. So I'm going to go through this one also very quickly. We have a lot of great speakers today. If you were not able to join the webinar last month, I would encourage you to check out that recording. This slide covers some of that information. So really just kind of a nod to, I know there's a lot of early childhood providers that have joined us today. I think that's probably our largest group I was seeing in the chat. So thinking about, are you trained or are you training your staff to make sure that you're aware of knowing when a student that you're working with is experiencing homelessness? Things like frequent absences, maybe they're not wearing clean clothes. So really working to know, even though that's not the service you're directly supposed to be providing, when you should be working with those other systems. And that's where we get to kind of the other piece, which is those partnerships, right? You can be so much more effective and efficient, right? Nobody has enough resources, but when you have those partnerships with the continuum of care, which, if you're not familiar with that term, really describes all the sort of path of housing options from emergency shelter to permanent housing assistance. So when you have those partnerships in place, that's another powerful tool for you to be able to refer families when they are saying that this is something they need help with. Next slide, please. Okay, so I do want to take a couple moments here because, again, I'm not sure how many actual housers or those of you who are familiar with housing are on today. So this is sort of a quick and dirty, and I'm very happy to answer more specifics. But you know, if there's time during Q&A and folks want that. When you think of public housing, probably the image that comes into your head is, you know, physical developments in a community. Right. So that represents about 1.2 units in this country, in America. And for context, the US has several thousand housing authorities, but some of them really administer a very small amount of housing. But public housing is exactly that. It's owned and operated by the housing authority. So you get a spot, you go, and it's tied, you know, directly to that unit. By contrast, a voucher, which is about double that if it's being administered by a housing authority, is something that the housing authority gives the voucher to an individual or family, but then you take that and you need to find housing on the private market. So you may have heard this called Section 8 housing. That just refers to the legislative name, or the Housing Choice Voucher Program. That's the biggest voucher program in the US. And as we've sort of heard a little bit in the introduction, there are pros and cons to this. Certainly, there is a potential pro for families that want to be able to go and live wherever they'd like. There's also research about the positive impacts of folks being in a quote unquote higher opportunity neighborhood. The downside, of course, is that it's kind of a big if, right? Voucher amounts are determined by geographic location. This is a set amount that is determined at the federal level. So it's not always enough to get a unit where someone would like to be, particularly when we're talking about families that need more than one bedroom. And there's also, unfortunately, sometimes discrimination that can occur with landlords. So then this kind of other bucket of housing is made up of things like the low-income housing tax credits. That would be a program that nonprofit housers are utilizing, other developers. And then I'll also talk a little bit later about some targeted vouchers that specifically apply to this population. But targeted vouchers means it's but you fit into specific guidelines. The most famous one in the United States is for veterans. So that's something called VASH, Veteran Supported Housing. Next slide, please. And again, we could do a whole webinar on this, so I'm not going to spend a ton of time, but do really want to make sure that I mention that a lot of what we see in the United States is the direct result of systemic inequalities. You may have heard the term redlining. That's an example of racist policies that have occurred historically in the United States that really have helped contribute to the disproportionate inequities that we see. And then we continue to see through things like what I was mentioning around possible discrimination from landlords, higher involvements with child welfare systems, things like that. Next slide, please. So partnering. This is really what I always recommend. It's what housing is built on. And again, want to emphasize that bare minimum, you're making sure that you have the information you need to get families started when they need assistance. But at best, you really develop partners where you have folks who you can directly refer families to, really work. You'll hear from AMHA about the incredible work that they're doing. And so sometimes these partnerships can inspire that to happen in your community as well. Next slide, please. I just want to highlight very quickly, and I believe a link will be dropped in the chat. This is a publication that I did a few years back based on qualitative interviews that I conducted, and it really seeks to spell out how to create and sustain a successful partnership. So this was specifically focused on housing and education, but there are mentions of early childhood in it, and would encourage you all to check that out. Next slide, please. Similarly, this is another publication that I believe the link will be put in the chat that highlights some of the really outstanding examples that are happening around the country, including specifically for early childhood. Next slide, please. Okay, so this and the next slide is about data sharing. I'm not going to go into a ton of detail. If you want more, ask me during the Q&A. This could also be a whole presentation, but this is something that we found to be incredibly helpful for partnerships in terms of determining joint goals and then also evaluating if the intervention you're trying is making any difference. It's not easy, but we found that it can be incredibly worthwhile for, say, a housing authority and an early childhood organization to share data across their joint population to really figure out what is happening in their community. Next slide, please. So you can see here, and I think this may also be dropped in the chat, if you go to housingiS.org, you can see data sharing agreement templates that we've created that you can use as a starting point to help create one with your partners. Next slide, please. Okay, so I'm sure you all are aware that there have been a lot of discussions about the budget. There was an initial budget proposal released in May where the administration called for states to design their own rental assistance programs. This would be a dramatic departure for how housing assistance exists right now in this country. Right now, it's at the federal level. PHAs, public housing authorities, are basically quasi-federal agencies. If it were to become a state block granted program, that would be such a change that it would require enormous administrative costs, and the budget, shockingly, did not provide enough for housing assistance as a baseline. So to also have to pay for all of these administrative costs to essentially create an entirely new program is very, very concerning. Last week, the named One Big Beautiful Bill was signed into law. So what this is really meaning right now is that, you know, kind of broadly speaking, for provisions affecting this population, there was somewhat of an increase in the child tax credit, which is potentially a good thing, but very concerning decreases for Medicaid and SNAP, which is, you know, food assistance. In terms of housing, there was one bright spot, an actual historic increase for low-income housing tax credits. However, unfortunately, it did not include something called the ELI, Extremely Low Income Basis Boost. So that was very disappointing, as was, as I mentioned, the lack of appropriate funding for what is needed for housing assistance in the United States. So what does this mean? Unfortunately, this means that those wait lists will continue. There's simply not enough housing in the United States right now for everyone who qualifies for it. Next slide, please. So I do just want to say, as I'm winding down, I want to be mindful of my time here, that we are currently involved in an effort called Thrive from the Start. You can scan that QR code or a link will be dropped in the chat. But this is an effort to work on solving infant and toddler homelessness. We're doing this in conjunction with other organizations, and we're very excited for others to come along, join us as champions. In the coming months, we will have specific action items, but right now we do have a policy agenda, and there's other ideas in the pipeline. So we are really looking for folks to get more involved with that. And I would say really, if you don't already have a partnership with your housing authority or your housing agency in your community, contact them, make one, have a meeting, and see what you can accomplish with them. So with that, I'm going to go ahead and pass it on over to the next presenter, but happy to go into more detail on anything during Q&A. Thank you.
Thank you so much, Abra. You covered so much in such a little bit of time. That's very impressive. Just, you know, I think the focus on partnering with your local housing authorities is just really critical. I have been in the early childhood field for a very long time and have worked at early childhood education programs. And I don't think housing was at all on our radar. And so it's such a good reminder that early childhood is about the whole family and serving the whole family. And I appreciate your update on the big, beautiful bill, so-called. And it is disappointing to hear that the funding has been reduced. And it also is a call to action for all of us that the work that we do is that much more important right now. So thank you so much for that. And we are going to move on to hearing from, I believe it's Jill and Hannah from the Akron Metropolitan Housing Authority, and talk about some initiatives that they are working on in Akron. So take it away, Jill and Hannah.
Thank you everybody for joining us and for giving us this opportunity to share what we're doing here at the Akron Metropolitan Housing Authority, which I will be calling AMHA because it's a mouthful. The next slide, please. So our housing authority provides services to our whole county. We're located in Summit County, which is in Northeast Ohio, just below Cleveland. Our county seat is Akron, hence our name, the Akron Metropolitan Housing Authority. Akron is our largest urban area where we see the highest need for our services. Next slide. So here's a quick summary of the units that we operate. You'll see we have about 4,800 public housing units and about 5,800 vouchers. Our housing is always full, and we have over 20,000 people on our wait list, which is just a startling number, and it shows the affordable housing crisis that we are experiencing here in Akron, but we know it's also happening all around the country. We are not unique in that. Next slide. So we serve over 22,000 people, and of those, 2,500 are children under the ages of 5. So that is almost 10% of the children living in our county. So that's a significant number of kids that we have the ability to possibly have an impact on. This chart on the left side is just a quick summary of the age ranges of our kids. You'll see that our highest numbers are in the early years. So it starts at 0, goes up past 100. But on the left side, you'll see in the green, we tend to have highest numbers in early childhood and early school age years. And then we tend to drop down before rising up again at adulthood. Next slide, please. So today I'm going to talk to you a bit about Full Term First Birthday. That is a county initiative. It's led by our Summit County Public Health Department and the City of Akron. We are one of the many organizations that participate in this collaborative. It's called Full Term First Birthday, and it focuses on maternal and infant vitality. You may be more familiar with the term infant mortality, but in our county, we use the word vitality to focus on the positive work that we are doing to combat infant mortality. Infant mortality is defined as the death of a baby before their first birthday. This collaborative was created to address the high rate of infant mortality in our county and the significant disparity in birth outcomes between our white and African American or Black babies. Partners that sit beside us include our local hospital systems, which are Cleveland Clinic, Akron General, SUMA, and we also have our local Akron Children's Hospital. We have other organizations such as Project Ujima, Minority Behavioral Health, Community Actions, Pathways Hub, home visiting programs, and more that are all working together to make an impact on reducing the loss of our infants. Next slide, please. So we know that safe and secure housing increases maternal and child health. So we started having conversations with our local health department and the Community Action Pathways Hub to see what could we do to get our pregnant mothers into housing quicker. So it was proposed that we add preference points to our wait list, which would give families the ability to move up the wait list faster. So all we basically had to do once we decided that's what we wanted to do, we took that information to our executive team, showed that there was the need, and they agreed to give to pilot about 10 spots, 10 families to get these preference points. So they wrote it into our annual plan, and in 2021 we started providing that. Let's see, to be eligible, this has a quick list of what it takes to be eligible. The main one being it's a pregnant woman who is in imminent risk to be homeless, and they need to meet the qualifications for housing. Next slide, please. And this is what our referral form looks like. It is super, super simple. And once it's completed, it tends to move quickly through the system. So it's sent to our health department, who oversees the divvying of the preference points. And once they make the decision, they send it to our housing placement team, who take over. Since the points were added, we saw a slow start, but we're really starting to see a lot more of them being utilized. And I think we've had a lot to do with that internally also, because we have our own programming that is a part of Full Term First Birthday. We have our early childhood initiative. So our resident services department is somewhat unique in that we have a large team devoted to early childhood. And this is where I'll tag in Hannah Horgan, our educational initiative supervisor, who is going to tell you a little bit more about the services that our agency provides in addition to just housing.
Thank you, Jill. Next slide, please. And thank you all for, again, the opportunity. I'm Hannah. I'll be taking over the remainder of the slides for our presentation this afternoon. So Jill kind of touched on the supportive services that Akron Metropolitan Housing Authority provides through our Resident Services Department, which is comprised of a team of about 40 individuals, all ranging from roles that support self-sufficiency initiatives, financial wellness, and early childhood and educational-based programming and partnerships. And so this is where we lies in that educational piece. Next slide, please. Building for Tomorrow is Akron Metropolitan Housing Authority's nonprofit arm. So AMHA, as a HUD-funded institution, is not eligible to apply for particular grants or foundation-based funding. So in order for us to meet the needs of our residents from a direct service standpoint, Building for Tomorrow was established we just celebrated a birthday, Jill. How old is Building for Tomorrow now?
10.
10 years. So for about 10 years now, Building for Tomorrow has been supporting residents living in public housing and with housing choice vouchers in the areas of education, community building, digital inclusion, health and wellness, and self-sufficiency. It is through Building for Tomorrow that allows us this flexibility to implement the Early Childhood Initiative, which supports education, one of Building for Tomorrow's focus areas. The annual cost of providing all these amazing comprehensive services to families is $1.4 million every single year, which is a seriously significant budget. And in today's day and age, at this national scale of funding changes, it's not easy to kind of make sure we meet that mark, but we've done it for 10 years and have really just built it up. Next slide, please. So a large chunk of that budget is the Early Childhood Initiative. So it costs us $800,000 to implement our early childhood programming. And so here you can see this graphic is representative of what the structure of that funding model looks like. In order to provide high quality, broad range services, you really have to be able to rely on a diverse funding structure. We're very, very grateful that we have 14 local foundations and grant opportunities that support nearly half of our budget, in addition to state and local government support as well. This diverse funding allows us to prioritize supporting a family regardless of housing status. We are able to serve people who are on the wait list, who are non-public housing, income eligible individuals. They may come into housing, they may exit housing, and we do not have to leave that family behind. They are able to maintain the support of their early childhood initiative program for whatever they have engaged with, whether it be home visitation or other services we provide. That continuity of services is really vital to those outcomes for children, health and education based for infants and children. Next slide, please. So let's talk about the Early Childhood Initiative. ECI, as we call it, we provide 3 pillars of services, is what we like to say. One of those, and our primary one, being evidence-based home visitation. So we implement 2 different curriculums to support children and families in being their child's first and very most important teacher, because a lot of parents don't know that. And so Parents as Teachers is our first curriculum we began implementing in early, I believe, 2011 or so. We serve parents prenatally all the way up to kindergarten entry with that program. It is also a Help Me Grow approved curriculum. If you were wondering, it's used nationally and internationally. Spark Ohio is the other curriculum we utilize, evidence-based, and is implemented to support 3- and 4-year-olds for kindergarten readiness. That curriculum is comprised around the Ohio state standards for kindergarten readiness. Go ahead and, oh wait, one more thing I wanted to say. This model is very unique, and actually we were one of the first we were the only housing authority to have its own childhood-based initiative within the housing authority. So it was groundbreaking in that we were able to begin this social bridge between families coming into housing or living in housing and having this direct childhood-based connection to the system through which they were living in. And that is such a huge thing for some families that have never navigated a large, complex, federally funded system before. Part of our job is not only teaching parents to be their child's teacher, but it's helping them navigate the systems that they live inside of to ensure that they can maintain their housing, prevent evictions, and all kinds of other things that life throws to them. All right, next slide, please. These are just some of the 2 other pillars that we as a ECI initiative implement. So family events are a huge part of our job. We implement 20 per year, and we host these at our largest family public housing developments. Creating a sense of community within public housing is difficult, but we have been able to do it successfully for 15 years. And families and community members alike just really love coming out to support these events. We support about 1,200 individuals to come out at these events every year. And in addition to that, they connect with all kinds of community resources. Community legal aid will table. We've got Akron Children's Hospital that comes out. Mental health and early childhood providers come out, and it's really just a broad range of support for families. And then we also host our maternal depression support group, which is on site for families right in their backyard. Sometimes a barrier to accessing any kind of support is transportation, but this one they can walk to. We provide a meal, the YMCA attends and provides childcare, and it's non-clinical support. It's really wonderful, and that one also has been occurring on site for over a decade, and families really look forward to the opportunity. Our initiative also helps to meet basic needs for families. We are a diaper bank, and thanks to the Baby to Baby National Network. And then we also are an approved Cribs for Kids provider. Our staff are trained and utilize the ABCs of safe sleep every single day in their work with families, making sure that those babies are safe when they're put down for a nap or bed, and that the parents have a safe space for their children to sleep in. Next slide. And of course, we've touched a lot on the importance of partnership throughout this whole presentation and this entire webinar. I know I've mentioned multiple agencies that we partner with, and I just can't say it enough that we as a housing authority know we cannot do it alone. The partnership of other community entities is vital to us ensuring our families reach that next step in life and achieve those goals that they set for themselves and their families. This on the screen is just a few examples of the things we're doing to make sure our kiddos and our families have what they need. We do tutoring on site. We have preschools on site, clothing closets to meet basic needs. Our libraries love to come and do story times, bookmobiles, and youth-based events. One of our libraries was out tie-dyeing with all the kids in the neighborhood. We had 90 people in a parking lot making tie-dye t-shirts, and they just had the time of their lives, connecting with safe adults and grabbing a free book and learning something that day. Public health every year puts on a baby shower, a huge baby shower, and we're so thankful to be able to connect our family with the resources they provide at those events. We also sit on the Child Fatality Review Board, and if you are an early childhood provider in the community and you think that this may be a vital opportunity for you to find out where your agency could help improve health outcomes for your children, and you're a massive system, I think that's something you should definitely consider looking into if appropriate. And then we also work really closely with our local children's hospitals, doing car seat distributions and safety checks. They provide helmets to our kiddos for free, conduct asthma screenings, and of course our Cribs for Kids partnership. I think that the most important piece with this cross-sector relationships is really what Abra has already driven home, is that data-driven piece. Those having data sharing agreements in place to make sure that the interventions you're conducting are appropriate and that they will make a difference is going to be the most important part of actually having an impact on the things that like infant mortality and health outcomes for children that we're looking to see. We have an example of one we did in the fall of last year. We had been talking at length about how we'd seen an increase statewide in infant mortality and what could we do to change it. So our health department looked at zip codes in our county where there seems to be a higher incident of infant mortality rates before the child's first birthday. They identified a zip code and we talked it through. Hey, we've got a lot of AMHA housing developments in that area. We have a high count of voucher holders in that zip code. What can we do to reach out to these families? So we have access to their phone numbers. We can reach out and say, hey, we've got free crevettes if anybody needs anything. We hosted a large event and we were able to distribute around 15 crevettes and provide safe sleep education to those parents as well. And that's 15 moms, 15 caregivers that did not have that resource before. And maybe we would not have reached had we not taken a look at the data and really gotten into it. So again, that data-driven piece is very valuable. And next slide for us, please. We want to thank you for the opportunity to share a little bit about what we do. We have all kinds of other things we do. We'd love to chat about. If you have anything you'd like to follow up with, please reach out to Jill or myself, and we'll be happy to answer any questions during the Q&A session. Thank you guys so much.
Thank you so much, Jill and Hannah. You see the presenters' information here. We will also at the end, probably sometime next week, circulate the entire recording of the webinar along with all the resources and links that have been discussed here today. So I just want to make sure everybody knows that. There are 2 quick questions that came in, well, a couple of questions, but we'll only have time for 2 so that we can get to Beth's presentation. So Jill or Hannah, I don't know which of you might want to take this. Someone asked if there's a document that summarizes your full term first birthday initiative. Is that somewhere on your website or a link that they could quickly grab to learn more about?
No, I don't believe we have anything specific to the preference point. Full term first birthday does have a strategic plan on their website. I can look for that link and share it in the chat.
Okay, thank you. Appreciate that. So we can get that out to everybody. And then the next question that we wanted to lift up that's specific to you, Jill and Hannah, has to do with, this establishment of the preference point, has anyone said to you or your organization that it's in violation in any way of HUD's guidelines for waitlist management? Or more broadly, any pushback about this preference?
Right. No, we haven't gotten any pushback. I think that is why it had a slow start, because our legal department and everybody, they made sure, took the time to make sure it was legal and we were able to do it. In addition to this preference point, we also offer points to veterans and emancipated youth. So those were in existence before this full term first birthday preference point. And we write it into our annual plan for the agency, which is known as the ACOP. So that allows us to give that preference. And it's not a huge number of individuals that are getting these preference points. Like we just have 10 for this particular one. I'm not too sure about the numbers for the others, but we try to keep it as fair as possible.
Thank you. Well, Jill and Hannah, thank you so much for giving us a clear picture of what's possible when housing is used as a platform for child and family well-being, and for showing us what bold bold coordinated action can look like. And I really enjoyed looking at that slide that you had with the cross-sector relationships and the ways in which you really coordinate well with other organizations to get families what they need. True example of a whole child, whole family perspective. So thank you for that. Now we'll hear from North Carolina and move us right into a statewide impact. So Beth?
Hello, Beth Bordeaux with Partners for Impact. Looking forward to sharing with you all some of the great work that's happening in North Carolina that we've been involved in over the last 3 to 5 years. In particular, our partners have been Early Years, which is a statewide nonprofit organization, as well as the North Carolina Division of Child Development and Early Education. So the things we want to directly address today is why is it essential to focus on the efforts for the whole family, not just parents, but really looking at the needs of children as well when they're experiencing homelessness or when a family is experiencing homelessness. We at Partners for Impact are facilitators of systems change. So a lot of our work is about moving into communities and building capacity. So we're looking at systems, silos, and opportunities. How can we build bridges? How can we don't create a program ourselves. We go in and create the opportunities for programs and connect across systems. And so then also looking at how communities can uniquely support young children when housing is temporary in ways that help follow the child when housing becomes permanent. Now in North Carolina, there's over 37,000 students between pre-K and 12th grade in the year 23-24 that were experiencing homelessness. And you can see the list of where they were staying, but the one that really strikes me is that 4%, that almost 1,500 individual children were sleeping outside. And that means in a tent or a car or, someplace that's really not meant for habitation. Over 11,000 additional children under 3 were experiencing homelessness that same year. And we know that homelessness is connected with trauma, right? So that traumatic experience actually changes the way a child's brain can develop. It doesn't just change the way they respond in day to day. It can change the way their future plays out. So it's really critical to try to address those things. It's not homelessness in and of itself, but rather the various different experiences that may happen or that a child is more likely exposed to. Over 90% of women that experience homelessness also experience some kind of violence. And so that means obviously the children that are involved are either witnessing violence or they're experiencing violence, or they may just have a fear of it. If you're sleeping outside in a public place, there's a fear of safety in the middle of the night when you hear a rustling, right? Eviction means your stuff can be laid out on the street for the trash collector to come pick up. That's a traumatic experience to see your toys and the things that belong to you and your family in the street. And there are many other ways that children can experience trauma in this kind of situation. But we also know from science, and a few people earlier have talked about this as well. We know from science that it's the positive experiences that really make that shift, that healing shift for children so that they can be resilient, so that they can grow through alongside those negative experiences. If they have that positive experience, the positive experience overpowers, right? It's stronger and it overpowers. And so that's why in a lot of our work, we are coupling high quality childcare as a primary resource for children at that time when their family is unhoused or unstable around their housing. Because if they can have that positive childcare experience, then they get that day-to-day stability and that day-to-day positive thing that kind of keeps them going alongside giving parents an opportunity to do the things they need to do in order to shift the situation. Now, to talk about some of the projects that we've been working on specifically, the one we're working on right now with Early Years is the Young Child Homelessness Outreach Project, and it has 2 primary focuses. One is on the local community and the other is a statewide initiative. So we picked local communities. There are like 6 of them right now that we're working in, where an outreach person is connecting with the homeless service providers and family service providers. It can be a family resource center or a food pantry or a child clinic. Or a shelter or a housing organization. But any of those organizations that are serving families that may be experiencing homelessness, whether they identify as that or not, but they may be experiencing homelessness, and then we're connecting them with the resources that they can use to get into that high quality childcare. So those resources include both a childcare subsidy as well as a childcare resource and referral. But the child care resource and referral for this is an enhanced program specifically for families that are experiencing homelessness that has a case management type component to it, where they give more information than just a list of child care centers, but they actually walk a family through getting connected to the right center that meets their needs, finding the resources to help pay for that child care, and then also ensuring that we know which centers have openings, which centers are really going to fit where you need to be. And so working with them through all of those processes. The second component to the work is a statewide level, and we are releasing the Young Child Homelessness Journal of North Carolina, which is an online newsletter that goes out every other month right now. Eventually, it may be quarterly, but it is packed full of resources and information for folks at the policy level all the way down to direct service, right? We give hands-on, really concrete ways that folks can help identify families that are experiencing homelessness, policy initiatives, ideas and latest research on how to create positive environments wherever a child is. So these are the kinds of resources that we're putting out all across the state, and we're constantly building that newsletter list so that we can get this information out as far and wide as possible. A few years ago, we completed a project with Early Years around the early childhood self-assessment tool for family shelters. So this again was a statewide initiative where we did a pilot project for 3 years, working with various different family shelter programs across the state, helping them to implement this tool that looks at everything from health and safety issues to intake processes to see where are we addressing the unique needs of children within this shelter environment, and where can we shift, where can we make changes in our processes that better address the needs of children. So we had shelters, after doing this assessment, to come up with things like new intake processes that have particular questions that assess where a child is developmentally, like little simple things, and determine whether we need to engage a screening process for them developmentally. Where are they involved in childcare, and how can we make those connections happen? We've also had folks look at their shelter environment and create a whole environment that is child friendly, assuming and realizing that children are going to be all over your space, right? You can't just put them in a room that's a playroom over to the side. They're going to be all over your space. So how can we make that whole space really child welcoming and child friendly? And we're not just talking about plugs, right? Like safety plugs. We're talking about having things down low that entertain kids while mom's working or on the phone trying to make arrangements for something. So tons of really cool things, initiatives came out in each and every shelter that did this program. And when we finished that work, we developed a toolkit that shelters can use in their program, as well as communities can use to look at a system level change around how to address the issues of young children in their community that are experiencing homelessness with their families. So this toolkit is a great technical assistance tool that walks you through the process of developing that action plan in response to the assessment that you've done in your shelter, and then how to even think about where the resources are that you can reach out and develop resources to help implement your action plan. It also goes into the policy level and the system level, looking at those initiatives and what can change in your community and how you can rally others to come together around that change. Now, Partners for Impact can work with this toolkit in a community, or you can take it and do it on your own. We're currently working with other partners in North Carolina to see if we can take this into a statewide initiative. Another project that we did with early years in the same kind of vein is we actually did do that work between the young child sector and the homeless service sector. So in 2 communities in North Carolina, we reached out in Durham, which is a more urban, centrally located community, and then we had a 4-county rural region in Western North Carolina that we worked with. And in both communities, we did the same process. We brought together young child providers and homeless service providers into several meetings across the course of a year, where they really uncovered what are the local issues that are the most challenging for families, and what are the things that we can actually do something about now, right? What's the low-hanging fruit? What's the most urgent thing? How can we make shifts? One of the things that came out of that was like some bridge funding. So when subsidy dollars are not available or there's a waiting list, there's some bridge funding and a few childcare centers that could take on children kind of at the spur of a moment with that bridge pro funding to cover 2 weeks to a month of childcare while someone is getting all the paperwork in place in order to get subsidy dollars to cover. Or if a family is looking for a job. In North Carolina, our subsidy dollars are tied to someone who is either in school or working. So during that season when you're looking for a job, the subsidy dollars are not available. So in North Carolina, we need that bridge funding to make that happen, or we need policy change. So another cool thing that is happening at the state level in North Carolina, there's a organization, the task force that's come together called Yay Babies. And they put together this statewide action plan for addressing the needs of young children who are experiencing homelessness. And these are the 4 core components to that action plan. The first is really building capacity of early childhood providers and understanding, and I think someone earlier talked about this as well, understanding that what a family is really experiencing, right? And how can we, even though it's not our jobs, how can we be compassionate? How can we create opportunities to support those families and those children in those seasons, right? And then the second is around really building capacity for organizations to have this 2-generational approach to address both the needs of young children as well as the needs of the whole family. The third is to create this integrated, accessible, child-centered, community-based systems change initiative. And that's actually the work we were doing when we worked in Durham and when we worked in the 4 counties in the West. Bringing those groups together so that you can uncover some of the unique issues in your community. But the other thing that when you do that across multiple communities, we're starting to see that there are the same problems across the state, right? So that gives us things that we can advocate for. We really understand what some of the core issues are that are facing all communities across our state. And then the last one, of course, is to leverage and really better understand our data, because we know that homeless service data from HUD and that data that comes from school systems is really different and not very integrated. So that's all I got. I would love to talk with you guys more about this, but thank you so much for having me.
Thank you, Beth. Boy, howdy. There's a lot going on in North Carolina. Thank you so much for sharing that with us. I know that you may be getting a lot of follow-up calls and emails from folks wanting to learn more and how they can get that started. And the example that you're setting for cross systems work is really fabulous. So thank you for sharing that with us. We're going to move on to the question and answer section of the webinar. We don't have a whole lot of time, so we're going to ask all of our presenters to make it short and sweet. And we will then be able to wind down the webinar on time because we know everybody's time is precious. So my first question is for Sheena, actually. Sheena, my question for you is, what do you want people to know about, one, how strong a parent or a family has to be when they're going through homelessness, when they're seeking out these resources, and how do you think service providers could focus more on that strength instead of putting up barriers?
Sure. Thank you, Michelle. So first of all, the strength comes from inside, right? It comes from inside. When you're backed into a corner, we do what we have, especially as parents, caregivers, for our children. So, I think systems put in place as far as my understanding is that I think just showing up, being there. I found that following up with my family. So my children, I'll be really brief. My children, you're aware they're sick. So our hospital is our second home. So the hematology department at Nemours Hospital in Delaware, that's our second home. So they have a program for the caregivers, just to follow up with caregivers, see, where your mental is, what do you need? How can we help you? Because it's a lot, especially on top of homelessness. So I think that's one of the systems that can be put in place, just following up, and then following through with the following up. So, yes.
Thanks, Sheena.
Good. So I'm going to pick up from here and take the next question if I could. I'd like to ask Abra a question. You gave us a lot of great information about just the national overview. I'm curious because you work at the intersection of housing and child development. What's one thing that each sector still doesn't get about the other?
Sure, yeah. And we've spent time over the years creating definitions and glossaries for folks. So I think terminology is a big one, right? What the housing sector might call one thing, the EC sector might call another. But I think it's still just about making that connection and that partnership. I think, for example, um, it can feel really frustrating as a direct service provider. I know when I was doing case management earlier in my career, it felt like, oh, you're already on the wait list for housing. There's nothing else I can do for you. So I think really understanding what might be possible in your community and knowing what resources that you can tell folks about is a really powerful tool, from the early childhood side to the housing side. And I think then vice versa, doing things like AMHA has, we've come really a long way. There's a term in the field called sticks and bricks, right? So it used to be in the housing world that it was literally just about housing people, just about the sticks and the bricks. I guess we probably don't really use wood anymore, but and I'm really pleased to say that there has been tremendous movement, certainly since I started in this space 11 years ago, that folks are looking much more at how can we provide these other services, but there's a lot more to go. And I think it's really helping housers understand that we're not asking you to become deep early childhood experts. You can still be the housing expert, but how can you help bring those services to your families?
Great. Thank you, Abra.
I have a question for Jill and or Anna, whoever you would like. There's lots of cities and states represented, and folks from the audience from across the country. And I'm wondering, you all are doing so much. At one point, you had to just start. So what would your suggestion, what would you say to other communities who may want to start doing some of the great things that you're doing? How do they get started?
I think it's talking with the residents to make sure it's something they want or need. I think that's of the utmost importance. And then also all of your partners, like who else has a vested interest, the schools, the libraries. I mean, I think it's really easy to get people involved with the housing authority. It's easy to get partners to tag along on an event or to provide any kind of service, because these are a lot of the families that they're trying to reach also. But it's just relationships with those doing services in your community, I think. What about you, Hannah? You got anything to add?
I would have started the same way, is to talk with your stakeholders, who in the community, residents and community partners alike, should be at the table to kind of shape this, inform this, and make sure it's responsive to the community it would serve. And I think another piece of that would be, you would want something strategic in that building piece. So making sure that you have a committed team that is going to stay around for a while and really see it to fruition. I know in a lot of fields and spaces where you're doing social-based services, there's a lot of turnover. So ensuring that if you're going to start something, that however you staff it or however you see it, is that they're committed to it and will see it through. So it becomes a 15-year-long project and is only growing every day.
I'd just add one more thing. If somebody's looking to work with their housing authority and they haven't before, always keep in mind that we kind of are an exception. Not a lot of housing authorities have like the size of our department. So we have over 40 people. There's a good number of others who have large departments, but it's not the norm. I don't know, Abra might have a better idea, but I get reached out from housing authorities wanting to replicate. And I like to start off with that, because they're like, how do you do all this? Well, we have a lot of staff and we have the nonprofit that allows us to get non-HUD dollars. And it's a lot of work. It's a big commitment, but it's worth it.
Thank you. Abra, did you want to chime in?
Yeah, I mean, I think that's right. I think we've seen increased activity, which is absolutely wonderful across the country. But at the heart of it, housing authority's first priority is to safely and stably house folks. So it's sometimes not always possible. But I do think that's where the partnerships are so key, because I'm always trying to tell housers, we're not asking you to do everything. And I don't think that they should. I think also, this kind of goes to a question that I tried to answer a little bit in the chat earlier. We all, of course, feel that this particular population is so, so important. But I do think it's also important to recognize that every community has their own needs and challenges. And some housing authorities in particular do face immense political and public pressure. So for example, not to call out LA, but they really have a lot of attention on folks who are visibly experiencing homelessness, sleeping in the street. And that's not typically families, right? So I do think, a little bit of grace when you're approaching these conversations. I don't think that it's anybody doesn't care, but they do have a lot of sort of different things that they're trying to navigate.
Thank you, Abra. And so it sounds like, just listening to you and Jill and Hannah, that really a good first step is starting the conversation, right? And getting people to the table if they're not already there. And if you are one of the folks that are at the table, thinking about who's not there and who should be at the table. I also heard having a committed team. So not just bringing this topic up as a one-off, but making it a recurring theme that is discussed at interagency or community meetings. And I just have to repeat it because I heard someone say, asking people what they want, and not assuming that the people at the table have all the answers. So I think those are really important first steps that are worth just mentioning or restating to just inspire those who are listening to this conversation. Beth, I'd like to ask you a question, if that's all right. When we talk about barriers to housing, or just barriers in general, we often picture something tangible that's blocking progress. That's what we think of when we think of the word barrier. But sometimes the real barrier is what's missing. So when Abra was talking about, in beginning conversations between housing and early childhood, they share glossaries and definitions. So in this case, the barrier is being able to communicate, and they've created ways to communicate through tools like dictionaries and glossaries. So in North Carolina's instance, and I think it could be applied, more broadly, you've talked about leadership and coordination. So that seems to have been a barrier. And so that leadership and coordination seem to be a way to really guide strategy and coordination. You talked about this in the early childhood homeless community engagement report that you shared. So could you just talk a little bit more about how a backbone organization that provides leadership and coordination has helped counteract or get through this barrier of these different sectors that have not traditionally talked to each other to get them more to a place of cross-sector collaboration?
Yeah, I mean, that it's critical. When we started the work, the first thing that we did was looking at readiness in a community. And one of the things that we looked for readiness is who can lead from the community. Because Partners for Impact, like I said, like we're going to come in, and even the way the grant was designed, we're going to come in with a support, but there's got to be a local leader that owns the initiative, right? And will kind of help champion the initiative all the way through. And so it happens different in different communities, but like in Durham, for example, there is a family shelter that had used the early childhood self-assessment tools several years ago, and they had really revised the way their shelter works, and they had really elevated the needs of young children in their space and in their philosophy of the way that they did the work. And so now they were moving out into the community and wanting to make this a bigger community level initiative. And so because they already had that sort of foundation, us coming in alongside them just actually was able to boost that process because they brought a lot of the community partners together. In the current work that we're doing around the outreach, we're finding the same thing. We're having to deeply depend on the child care resource and referral organizations to help connect us with the others in the community to do that deeper outreach across the community because it's local communities who know their
Thank you,
people.
Beth.
You're good.
I'm
No.
sorry. I think my connection went out and I thought that you were finished. So I did not mean to interrupt you. Really apologize about that. Thank you, Beth. I think a question had come in for Sheena and she wanted to respond to it.
Thank you,
Sheena,
thank you, Ngozi. I think the question was, I don't remember the question. Can someone remind me of the question?
it might have been about the work you're doing now.
Yeah.
Okay. So the work I do now, I work for the Public Defender's Office here in Delaware. What I do is, I actually tell people I integrate my love of the law with my love of people. So and it's weird because I work with people who have been charged with murder one. So automatically, again, the assumption is they're terrible people, right? So yes, they've done a terrible thing, but they're not terrible people. So I feel like I can help them deal with issues. A lot of them have a lot of mental health issues. They have family issues, life trials, crisis trauma, everything, anything you can think of. So I feel like I help them to bring that out while they have to spend their time in jail. I integrate experts, psychiatrists, psychologists, things like that. So I think I answered your question, but that's what I do right now, and I absolutely love it. And I actually obtained it because I was able to obtain my master's degree while in the shelter. So it's something that I'm proud of, and I love what I do. So I hope I've answered your question. I apologize.
Thank you, Sheena. And that is just such a powerful testament of your service. And I think that's what this conversation is all about, service. I would love to just leave with just two questions that I don't know if you know it, but Beth, you raised something that made me think that this is something that everybody should take with them as we leave this conversation, which is who can lead and who can champion this. So we would love it if you would think about this as you continue to think about how to bring these two sectors together and serve children and families in a whole way. I do want to get us to the close. So Jonathan, if you can take us to the close slide, or Ingrid.
Thank you everyone for joining us today. Lots of information. You'll be getting, everyone who registered will be getting the slides. We'll be getting a follow-up email. You'll be getting more biographical information about all the presenters and contact information and all of the resources that they mentioned in their presentations. Thank you all to the folks behind the scenes, Zan, Tony, Tunde, Ingrid, Jonathan. Did I forget anybody? Ngozi?
Tony. Did you say Tony?
I said Tony. Okay, so I think I got everybody. Thank you all so much for making this happen. Where the webinar series continues. Save the date, August 7th, September 11th, October 9th is our final call to action webinar. We hope to see you all there. Thanks so much for being here.
Thank you.